What's up, my Support Fibro friends? How is everyone doing? It's Monday. Boy, am I tired. I don't know what it is with Mondays, but I've been having a case of the Mondays for a while. I don't know if it's back in the days. Did anyone love Garfield growing up? I remember loving Garfield and he hating Mondays, so I think I've just always adopted it. But I decided to do this Monday live broadcast to reach out. How is everyone doing? Leave a comment, say hello, where you're tuning in from, leave an emoji, and let me know what's new and good with you in the fibromyalgia space. Has there been any new fibromyalgia news that you've heard about? Please do share with the community so that everyone can benefit. I am Melissa Talwar. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine coach. Adjusting to the Monday fun. So I'm trying to spruce up your Mondays a little bit if you are having it's tough when you have Monday morning meetings. I need to get acclimated a little bit. So I'm doing this broadcast and sharing with you. I wanted to share some news updates for the organization as well. And we have some exciting updates to go through, and that's what I wanted to share with you. So if you're tuning in or if you're watching the replay, please leave comments and do like and share this content with everyone. We are saying hello to our Facebook, YouTube, and Twitter friends with more live broadcasts and more interviews on their way as I get my schedule ready, and shout outs to a lot of people that are doing some amazing work and we want to hear from them. I'm also learning new things as I'm going through the process. So we're going to be sharing a lot. We're updating to the website as well. So stay tuned for a lot of updates coming your way as we move forward with Support Fibromyalgia Network. And I'm excited to share some of this new information with you. So on Thursday, so this coming Thursday, August 11th, we're going back to school, and we're going back to school with our wonderful friend Brandi from Being Fibro Mom. So we're going to have a great session and share a special presentation with you as we are going through the family and fibromyalgia program. And so we're going to bring in all kinds of information for you as we head back to school. Please go follow her accounts at Being Fibro Mom. And we'll have some good information, and we'll have a lot of fun on Thursday, this coming Thursday at 9 a.m. Pacific, 12 p.m. Eastern. We will be broadcasting on all the same channels. Whatever channel you're watching now, we will be broadcasting on that channel live for you. So be sure to mark it in your calendar and tune in and ask a lot of questions. We love it when people are engaged and can share and have questions. And she's wonderful at balancing her family life with fibromyalgia as well. So we look forward to that presentation this coming Thursday at 9 a.m. Pacific time and 12 p.m. Eastern. So stay tuned. Also on August 20th, we have a special presentation. I need to test Hopin. So what we're doing, we're going to be hosting a lot of workshops through Hopin because we have to test I want to test as much as possible before our November conference and get really, really good at the technology and know all the features. So I invite everyone here to come and test. We have a free workshop I'm hosting titled it Functional Medicine for Fibromyalgia. It is going to be a patient's approach. So there'll be certain tools that you'll learn that I don't necessarily share live when I was talking about functional medicine one-on-one. This is an interactive workshop as well. There'll be some didactic and a presentation, but then I'm going to invite people I'm going to have a conversation with you. We're going to ask different questions. We're going to ask about any of things that are hard when implementing lifestyle and behavior changes. We're going to understand functional medicine a little bit better and how to approach it from a patient's side, because I know a lot of questions come up when it comes to testing, finding the providers. What do you need? It's very, very confusing. So we're going to dive into that. And again, please register. The link is in the description. And it is a free workshop. And the reason, again, is I need some live participants. So if you know that you can attend live, and I know with health and that changes a day to day. So I understand that. But if you do know that you're free, you're not on a vacation, or you don't have a prior commitment, please register for the workshop and join me live because I want to test the session experience in Hopin with a live audience as much as possible. So it is limited seating. We're only allowing 30 people to register for the event, but we're going to kind of get to dial in what it feels like. So as we move into November, we get in a better idea of what it feels like using the software. We get acclimated to interaction. So there you can, in these live sessions, turn on your camera and interact and ask questions. And there's also chat features. There's also polls. So this is a free workshop that we are going to be utilizing to test, and more workshops are coming up. So if you have ideas for these workshops, please share. I just went with this because I'm comfortable with sharing. And I do continue to get a lot of questions regarding functional medicine testing, how to find a practitioner, how to talk to a practitioner. So I'm going to dive into those details because it's a whole confusing world when it comes to fibromyalgia, and there's a lot of information going on. I'm going to share some of the lifestyle. We're going to map it out just like you've seen with the functional medicine tree, but then I'm also going to share some of the aspects of nutrition that they bring in. So there's a lot of handouts that you can acquire, or there's different, I guess, approaches nutritionally. So there's different nutritional guides that functional medicine provides. So we're going to dive into that. I'm going to talk about the differences of each of those as we get into this, because this is really dialing in from a patient approach to give you the information that you need in order to potentially talk to a provider in the functional medicine space. And hopefully they understand what you're talking about. But we're going to get into more of those information. And like I said, from previous talks, you've heard me talk about the matrix and the timeline. Will allow space for you to ask questions and dive into those details as you put it together. But a lot of the pillars that we're going to be focusing on with functional medicine is, again, focused on the bottom of the matrix. So sleep and relaxation, nutrition, movement, and at a higher level, what we can do, and then supportive relationships. But I'm going to talk about some of the other, I guess, some of the questions that come up too. Again, what to look out for with testing and all of that, because it does get very confusing with the differences in testing and what maybe you should do even before you go see a provider. So that's going to be a free workshop on August 20th, and registration is available. So please join me because we are testing Hopin in order to get things accomplished for fibromyalgia. And I know fibromyalgia itself is very, very confusing, but I do want to say this moving forward. So fibromyalgia is a well-known diagnosis. It does remain a challenging diagnosis to make for many of the healthcare providers. So there is a lot of misinformation. There's a stigma attached to it. But I do want to recognize that fibromyalgia is a criteria-based diagnosis. It can and does coexist with similar conditions. So this is where we're going to make the distinction before you go in, because there's two paths to sort of make when we're talking about moving forward with different providers. So the diagnosis path of figuring out what you're diagnosed with and differentiations and adding different diagnoses in there, and then the treatment path. So there might be different roads to take. And if for affordability reasons, we might consider the treatment path when you're going over to functional medicine. So I'll dive into that a lot when it comes to the presentation, because it is a serious mistake to consider fibromyalgia only in its absence. So you might miss fibromyalgia and like other things that are going on, or you might rule out the other things like rheumatoid arthritis with an eagerness to explain all of the symptoms as fibromyalgia. So there's going to be a lot of workup that you have to go through before you even begin. So that's what we're also going to talk about in the workshop, is deciding when to move on. And then also, again, basic tests that you can kind of do, because we already know the effect it has. And we want to be aware of the current evidence of most of the therapies. And to be honest, we'll go through some of those available therapies because there is limited to small trials within quality of data when it comes to the science and evidence-based science of the management of fibromyalgia. It can be really, really confusing. And then just understanding that you will need, before you go into these situations, some sort of description of your symptoms, and then also get a physical exam. So where is that going to come from? Who's going to be doing that? And we're going to get into some of of the responsibilities of what to expect. I mean, do you really need to, moving forward, expect rheumatologists to get fibromyalgia and understand it? There are people that do specialize in it and can understand, but they're really there to distinguish between other diagnosis and help you get to other conditions and understand it, because it can coexist together. So this is, as we jump around from different segments of the medical community, this is definitely something to understand. And even it's just trying to find the right provider and who do you go to, and then working with a primary care physician to try to get some of these conditions. And we really want to focus, as we move into the presentation of functional medicine on August 20th, we're going to focus on treating the treatable. So focus on taming whatever issues you may have the best that you can. So this is what we're going to move forward with. And I just really wanted to quickly show you the different things that you can pick up from normal testing when it comes before you move on to some of this specialized care, because it is complex, but you can get this covered through insurance purposes, and make sure that you have the basic blood test components, because it is a lot. As you see, like some of this gets missed and you might move on, and especially through telehealth, with an assumption that you are diagnosed with fibromyalgia, and then there's other conditions that might be happening, and what are they actually going to focus on treating when you haven't done a full workup yet before moving on to providers. So we're going to dive into a lot of those details, and as you can see, you have a complete blood count with differential, the basic breakdown of types of white blood cells seen on the sample. This screens for anemia, infections, blood cancers, or immune system concerns. Basic metabolic panel. I know we need to add like lipid panels in here. Checking for insulin glucose levels, vitamin D, sedimentation rate, CRP. So these are inflammation markers, ferritin, cortisol. So you're really looking to see what is happening, and there's more to it, right? And then even any overnight oximetry. So testing your sleep. So do you have any sleep apnea coming up? Any other sleep disorders, x-rays and other imaging, depending on pain location. So that's an aspect that gets overlooked before you jump ahead to some of these specialized care and functional medicine. We're going to dive into that too, because I know there's some cross in conversation with fibromyalgia and cervical cord compression. So you really want to dial some of this in, even potentially before you move forward, and what you can do ahead of time. And just to even reiterate how complicated it can be, because I hear this from a lot of people too, is if these are the types of blood tests that you could get with an undifferentiated connective tissue disease workup. So even just here, like there's some things that you have to work through before even moving ahead. And that's why deciding in the two segments of diagnosis, like what are you working towards? Are you working towards a definitive diagnosis, understanding differentials, understanding if there's anything else going on that will compound the effect of fibromyalgia? And then on the other side of it is the treatment. So the treatment part, and who do you go to? If you're overly sensitive to medications, you have a lot of bad reactions to medications, then this might be the different approaches for functional medicine or naturopathic medicine, going into all of these segments and understanding that as you approach it. But it is very complicated. So I'm hoping on August 20th, I can break it down for you a little bit easier as we move forward. So just remember this functional medicine for fibromyalgia patient approach. It's a free workshop, August 20th. I'm looking definitely for participants to join me live so we can test Hopin. I'd really appreciate it. So please try to just sign up if you know that you can attend live. And I understand health may get in the way, but if you already know you have a prior engagement, please allow people who can attend live and ask questions, because we're really working on testing the software for the upcoming conference. And I would really appreciate that. And there you go for the conference. So the conference is going to be November 4th and 5th. It is all virtual conference. We are hosting it through Hopin. And that's why all of these, you're going to see some other additional free workshops come up so we can test it. But we need you live as much as possible. We need the interaction. We'll be testing polls. We'll be testing the comments section. We'll have people turn on their cameras and ask questions in the sessions. I won't, for the functional medicine, turn on the live stage, but there is is a component of that. There's a patient meetup area if you want to network with other patients or just converse with them about anything that you've learned. So we're really going to dial in and test this software. But please save the dates for the fall conference, November 4th and 5th. We will have more announcements as we move forward. But in the meantime, take advantage of those free workshops so that we can test it. Anyone is invited. So the functional medicine one is open for registration. And we'll go through all of the stuff that you need to learn. And again, it's interactive. So I'm going to try to speak less. We'll go through some of the didactic and presentation, and then I'm going to throw it over to the audience to ask their questions and see if we can help and better understand how you can apply functional medicine into your home, into your own life when it's working with fibromyalgia. Ooh, I'm going to take a pause for a second. Yes. Hello, Lupus Spoons. Yay. And then Robin, hello. Estella, so good to hear from you. I'm super excited about all of this coming through. So I appreciate everybody tuning in. This is kind of just our update for the rest of the time period too. I'm excited for the fall too. Hopefully we can get our act together. We're reaching out to various providers. So we are looking forward to hearing from a lot of different providers. If there is a topic or a session you're interested in hearing more about, let us know, because right now we're condensing it. I'm really, it's hard. It's hard to condense so much content. Like I really want to have all this information condensed in 2 days. And I was looking at some of the other conferences, they break it up into 4 days, but okay, so I'm just going to go with it for 2 days and see what we can do, and see how much information we can put together that updates on like the current information for fibromyalgia. I do want to include our researchers. There's some amazing researchers that we want to support, some of them living with fibromyalgia. So I want to give them an opportunity to present. We're going to be doing some interviews to introduce them because they have a story to share. And I think it's fabulous that they've decided to not only live with a chronic illness condition, but they've decided to research it as well. So I want to share their story, bring them on, and then through the conference, give the didactic and really present some of their findings if they're available to do. Robin, I'm not sure which Dr. Katz you're referring to, but definitely please let me know specifically who. I think there's a few that come up, and I'm really intrigued in putting out we're reaching out to particular providers too that have various experiences. So they may not necessarily be the expert in fibromyalgia, but they have a lot of experience in looking at fibromyalgia and the differential diagnosis with other conditions as well. Oh, he's a researcher and a rheumatologist. Oh, that's awesome. I will definitely reach out because we need more people to come together and talk about fibromyalgia. As I said, we're really trying to break this stigma and figure out we don't necessarily have a complete specialist for sure in these settings. And rheumatology, again, we can't expect them to completely understand fibromyalgia when we don't have a good basis for where we exactly fall. And it's very confusing. There's a lot of people that have their bias with understanding how to treat fibromyalgia. So, and then with the research, not necessarily developing certain pathways, there's a lot of room for disagreement. So we have to have that understanding for the rheumatologist or the neurologist that may also attract fibromyalgia cases. It's a less bad fit, but we don't necessarily have the perfect fit designed yet because we're still not clear on a lot of things, but we are clearer on some of the other overlapping conditions and how they contribute. So what you need to look at, and we'll dive into that too with the conference. And then of course, in our different workshops, as we present them, we're going to be inviting a lot of technology companies to come in as well. I did want to give a quick shout out to anyone that is interested in registering. So the Patients Rising Now Masterclass is open up for fall 2022. you can register. There is a link in the description for you to register and go over. It's, I forget how many weeks of the course, but many of us have done. If you're looking to learn about more of the healthcare advocacy at Capitol Hill and how to approach it, they have a lot of information. You really do learn a lot about all kinds of things with healthcare advocacy. So I wanted to throw that out there for anyone that may be interested. Many of us have taken the masterclass, and it's always exciting when I see fibromyalgia advocates join the masterclass and really learn, and then they're excited to learn and they apply this. So there's so many ways to get involved with advocacy, and I just want to encourage everyone to get more involved as we move forward. Thank you, everyone. I just wanted to give can also talk. Oh, wow. Okay, Robin, I'm going to definitely touch bases with you about that because I love presentations like that. And the rheumatologist, it'd be great to have him on board as him or her. I said Dr. Katz. I can assume that I know what this person is all about. So we really do. Fibro is so painful. And this is the added effect of what we're trying to decipher and moving on. And I mean, I appreciate Lupus Spoons with joining us, and she gives us so much good information. Okay, so it's Robert Katz. Thanks for the distinguishing. When it comes to figuring out the overlapping way, fibromyalgia and how it overlaps with other conditions, how do you distinguish from each other? Is it your fibro that's flaring? Is it a combination of the both? And some people swear they can have a clear distinction, but they've probably taken a lot of notes and probably trying to decipher, but it is very confusing. And then as you're trying to figure out what else is going on, and something like endometriosis, which is personally coming up in my life. How do I know the impact until I really know if I have endometriosis as a diagnosis? And I hear this a lot too, because a lot of people in the fibromyalgia community have endometriosis. But the process to even get diagnosed is so confusing. It requires some aspect of surgery. So how do we know this is not compounding and contributing to any inflammatory response, any pain response? Because it's difficult to distinguish even with doctor's office. If you ever gone through the process, is it the OBGYN gynecologist? Is that where you're being sent to, or is this part of the stomach? They get really, really confused. And if anyone's done that, you spiral around those two providers until you can dial in where this pain is actually coming from, and someone does a good workup enough. So these are what gets really difficult when it comes to diagnosing correctly and the overlap and all the confusion when it comes to fibromyalgia, because I'm going to change it up and say it's actually a diagnosis of inclusion. You can have other conditions and have fibromyalgia, and how it works together is still in the works of research and understanding. And this is where we default to our patient's experience and understanding. We can actually start educating our providers because we're experiencing it. And the amplification, is it the amplification of pain? Where is that coming from? Are there other conditions that are contributing to that and compounding the effect? So it gets very, very confusing. Okay, Robin, I'm definitely going to be reaching out for you for multiple reasons. So I just wanted to jump on here and let everybody know I'm excited. So this Thursday, August 11th at 9 a.m. Pacific, 12 p.m. Eastern Time, we'll be going back to school with Brandi as part of our Family and Fibromyalgia program. So stay tuned. We'll be live streaming on all of the current channels you're watching now. So look forward to seeing you there. And then August 20th, we have the presentation. So sign up for the workshop if you can attend, so we can test what Hopin really feels like. I guarantee we'll have some fun. You'll get a lot of handouts too. I want to make sure you get your questions answered to the best of my ability. As a health coach, I am not an MD, so there's only certain things that I can provide as far as information goes, but you will get functional medicine type handouts as being part of the workshop as well. It's a free workshop because we are definitely going to test this platform and get very familiar with it. Please do add us as an Amazon Smile. We are an organization registered with that. Donations really do make a difference. Any little dollar amount does count. Everything goes 100% from this from Amazon Smile into the fibromyalgia programs. And if anyone has any questions about our fibromyalgia programs, please don't hesitate to reach out. We also still have always throughout year round the Seas Candies fundraising. So if you know anyone that loves chocolates and wants to, if you want to buy chocolates for other people or yourself, use our portal. Same kind of, I guess you can buy gift cards too if you're not seeing the candy that you want, and you can use it towards in-store purchase at any of the store locations, or you can purchase online using the gift cards. Gift cards are great and they still count towards the donations of the network and the organization. Then please do subscribe, follow, share our content on social media. I have to add the TikTok button here, although I haven't updated TikTok in a while. Still getting adjusted to TikTok. When I log in, all this information gets thrown at me. And I'm like, what is this? It's people I'm not following. So it's a little bizarre. I'm getting used to that and acclimated. Anybody have tips on that, please let me know. But we are on YouTube, Facebook, Instagram, Twitter, LinkedIn, and TikTok. So please follow us in the locations. Let people know about our nonprofit organization. Please do share our content. We'll be posting some reels as well, and that really supports us. If you are watching on Facebook, you can also give us stars, which Facebook gives donations. So stars gets turned into like a penny and converts over. But like I said, any amount of dollar donations really do matter to our organization. And we appreciate everybody doing birthday fundraisers. It really does make a difference. And we can't thank you enough because we are doing a lot and we have a lot of things coming up for the fall. So thank you everyone for tuning in. And okay, perfect. 15-week course for Patience Rising. I'm glad that people have registered. I'll be seeing you in the platform as a moderator for Patience Rising now. I'm excited about the new developments for the organizations. You're really going to learn a lot if you're interested in healthcare advocacy. And I know Barbie at iPain has her program as well that she's going to relaunch and register. There's a lot of learning that's going on with advocacy, and we're going to be moving forward with fibromyalgia advocacy as well. So please stay tuned to all our channels, and we will see you live on Thursday. Bye, everyone. Have a great rest of your Monday. Hopefully no more case of the Mondays, and I need to wake up. Okay, bye, everyone. Thanks.